Next are some what I would call common feelings or misunderstandings that people have. And you know, if someone said, I had $1 for every time someone said something, I mean, these would be on that kind of list. For an awful lot of people, they will ask me, am I going crazy? Just on Sunday night, I gave a talk like this, and unfortunately, a young mom had a child die, and she just said to me, just tell me I'm okay. Just tell me the way I am is I'm not really going crazy. Because this isn't something hopefully we've had to do very often, and it's not something that we're that good at, and a lot of times our emotions aren't the way we'd expect them to be. So there's a big fear of, is there something wrong with me, and is there something going on and going crazy, quote unquote. Another question people ask a lot is, well, why does it hurt so badly? Why does it still hurt so much? And that's an interesting question when you really think about it, because we know the answer in our hearts. We know the reason it hurt so badly is we cared so much. If we didn't care, it wouldn't hurt. But the real question I think that's going on when people ask me that is not so much, why does it still hurt so badly, but is it ever going to get any easier? This pain, I'd really like to get through this pain. And that's the next question people do ask is, will it ever get easier? And I'd have to be honest with you, from a counseling point of view, I feel it's my responsibility sometimes to tell people the truth. And you know, basically, will it ever get easier? Yes, it will, but probably not nearly as quickly as you'd like it to get there. So it's just something to think about, as I said later when we talk about time frame. Shouldn't I be doing better than this? A lot of times people compare themselves to other people, and they see somebody else, or they know of a friend or somebody that had someone die in their family or friends, and they don't see the same behaviors in that other person as they see in themselves. And so they might ask me, well, are they okay? Are they normal? And am I different? And the thing I would tell folks is there's 2 points. One is that we typically don't show on the outside what's going on our inside. So if we're feeling one way and we're seeing somebody else, in all likelihood, we're not seeing what's really going on inside them. And secondly, we don't know the relationship. We don't know the details often about someone's life. So there's a whole host of reasons, and we're going to talk about those a little bit. There's a whole group of those reasons as to why someone may grieve differently, even if they had the same 2 people lost a spouse, you know, or whatever. Is it okay to cry so much? As I said right when I started, crying is what most people need a lot of. And unfortunately, our world, as I said, doesn't let us do it too often. It may give us a little grace period, but then we can't. And I hear people saying things like, well, I must remain strong, or I must be doing. The reality is crying is exactly what we need. So the strong are the ones that can express that sense. It's not the strong who hide it. All right? And especially, we're going to talk about children later. It's okay for children to see adults crying. It's okay for them to see mom or dad or whomever else crying, because if nothing else, it teaches the child it's okay for them to cry. And so crying really is, unfortunately, not something we do, but it is not something that's overly accepted, but it really is something that we need to learn to accept more, in my mind. It's kind of funny, odd funny, that if we tell a joke and people laugh, that's all very well accepted. But if I were to tell a story and people got a little upset and started to cry, that makes people feel uncomfortable. And yet, crying and laughter are basically the same kind of expression of, you know, energy, just one comes from sadness and one comes from happiness or something that's funny. Are others getting tired of my sadness? I'd have to tell you, when I ask people that, I mean, most people will say, probably. And the reality is, yeah, many are. And part of the trick of going through this bereavement, grieving process is trying to find that you're okay in your sad place, but others around you who maybe don't want to be there anymore, they're okay too. And part of it's trying to minimize that tension between the two. And I've seen this in friendships, I've seen this in families, husbands and wives, all different combinations who are grieving differently and starting to get frustrated with the level of sadness in one or the other. Someone will say, well, you're pulling me down all the time, and the other person will say, well, you're not letting me be such and such. And the reality is we do go through this somewhat differently, and we just need to realize that. Time heals all wounds. We're going to talk about time a lot later, but it's a myth that just because of time, everything just gets better. It doesn't just get better due to time. I can handle this alone. Many people can. Many people go through it okay by themselves, but also many people are helped more by having people in their life, having friends, other family. Some go to see professionals, et cetera, et cetera. The next one is I don't want to be using medication. For many people going through grieving, some medical professional, doctor, will prescribe medication for depression or whatever else. I know in our society that a lot of people don't want to take that medication, and all I can tell you is that from my opinion, and having seen many people, that when a professional, a doctor prescribes this, it's something that could be very helpful to us, and we should listen or at least consult the doctor if we're thinking of changing that advice. The other thing is the myth part is that a lot of people have this sense that if I take medicine to help me through this, then somehow I'm not going to feel it, I'm not going to experience it, and that's really not what the medicine's there to do. So I point that out. And lastly, I like to talk about this one a lot, and we'll hit these as we go. But friends do say some pretty silly things. I just had a phone call before I was driving over here from a woman whose husband died, and she just elaborated on something that a friend of hers just went on about today. The kinds of things you hear, and there are hundreds of these, but you need to move on. Maybe you haven't heard that yet, maybe you will. What does that really mean? You need to move on. As if you're not allowed to be sad, right? You need to get out more. No, you don't. I'll be honest with you. And in fact, what we're going to talk about later is kind of the things that you should do and not do, quote unquote. One piece of advice I give people, and it sounds like I'm being a little sarcastic, and I am a little bit, but not totally, is for the most part, whatever friends tell you to do, I'd almost suggest you do the opposite. Because more times than not, the right advice is not what an inexperienced person will want us to do. See, what friends try to do is they try to think of things that will make you happy. So if going out to dinner with a group of people in the past made you happy, and you're kind of wanting to just hang out at home, they're thinking, boy, if I could just get her out, to dinner, she'll have fun and she'll forget all this. But the reality is it doesn't work that way. You know it doesn't work that way. I know that. But they're trying, but they're given pretty much the wrong advice. In my mind, the reality is that you need to actually go inward during this because you need to experience what it is you're going through to be able to come out the other end. I mean, one example that might help is just think about if you've ever had a broken leg or you've had surgery or something on a knee or whatever else. If you were in a cast or you were in a brace or something like that for a while and you had to heal and your friend said, well, just go run on it. Just pretend like the brace isn't there. I mean, that can't be right. And yet they have the same kind of advice when it comes to this type of thing. And going out and having fun and partying, that just frustrates people who are, most of the time, who are grieving. So these are just things. And even the last one here, it says that she's in a better place, at least they're not suffering anymore. I understand what people are trying to say when they say things like that. But the reality is, I tell people all the time, it's not about where she is, whether it's better or not. It's where we want her to be, which is here with us. So the grieving has nothing to do with the idea of where they went. It has a lot to do with where they aren't. And we're really grieving ourselves for the fact that we wish they were with us.